Hello, I'm Warren Geller, President and Chief Executive Officer at Englewood Hospital and Medical Center, where our mission is to provide the safest, highest quality, compassionate care to the communities we serve. Our number one priority is our patients and their families, which is why we offer a comprehensive, multidisciplinary approach to pain and palliative care for those diagnosed with serious or chronic illnesses. During this video, you will learn about our services and how they may benefit you or a loved one. Our palliative care team's unique integrative approach focuses on treating the whole patient, mind, body, and soul, so you can rest easy knowing your health and quality of life are in the best hands. I am proud of our staff's commitment to bringing a superior level of care and comfort to your bedside. Thank you for choosing Englewood Hospital and Medical Center. It is our privilege to care for you and your loved ones.
Hello, I'm Dr. Jeff Gooden, Director of Pain and Palliative Care here at Englewood Hospital and Medical Center. During this video, we will introduce our team and describe the beneficial services available to you and your family. Palliative care is specialized medical care for people with serious medical conditions. It focuses on providing patients with relief from the symptoms, pain, and stress of a serious illness, whatever the diagnosis. Our goal is to improve the quality of life for you and your family. Palliative care here at Englewood is provided by a team of doctors, nurses, and other specialists who will work together with your doctors to provide an extra layer of support. Palliative care is appropriate at any age and at any stage in a serious illness and can be provided along with your medical treatment. Palliative care treats people suffering from serious and chronic illnesses such as cancer, cardiac disease such as congestive heart failure or CHF, pulmonary disease such as COPD, kidney failure, and neurological conditions such as stroke, Alzheimer's, Parkinson's, ALS, and many more. Palliative care focuses on symptoms such as pain, shortness of breath, fatigue, constipation, nausea, loss of appetite, difficulty sleeping, and depression. It also helps you gain the strength to carry on with daily life. It improves your ability to tolerate medical treatments, and it helps you have more control over your care by improving communication so that you can better understand your choices for treatment. Palliative care is a team approach to care, one that creates a partnership of patient, specialist, and family. The core team includes doctors, nurses, and social work palliative care specialists. We also have massage therapists, pharmacists, nutritionists, chaplains, and others as part of the team. Our team spends as much time as necessary with you and your family. We become a partner with you, your family, and your other doctors. We will support you and your family every step of the way, not only by controlling your symptoms, but also by helping you to understand your treatment options and your goals. Working together with your primary doctor, the palliative care team provides close communication, expert management of pain and other symptoms. We'll help you navigate the healthcare system. We'll give you guidance with difficult and complex treatment choices. And most of all, we'll provide emotional and spiritual support for you and your family. If you or a loved one has been diagnosed with a serious illness, you may benefit from palliative care. Please ask your doctor for more information.
Generally speaking, patients are admitted to the intensive care unit if your attending physician along with the critical care team feels that you would benefit from enhanced monitoring and treatment for impending organ dysfunction and/or failure. Often the intensive care unit is the only place at Englewood Hospital Medical Center where certain therapies are provided, such as mechanical ventilation. Palliative care is not different from ICU care. As you have heard from other members of our palliative care team, palliative care is an adjunct to traditional medical care. Palliative care is intrinsically linked to intensive care. As we are providing aggressive ICU care, we are also focused on alleviating some of the burdens of such care, such as pain, suffering, and anxiety. At Englewood Hospital Medical Center, we recognize that from the time of admission to the ICU, all critically ill patients and their families may benefit from palliative care, which is provided along with your medical care. It is also important to know that palliative care is not just for the dying. We are focused on providing a global, comprehensive approach to your illness, whether or not it is life-limiting. At Englewood Hospital and Medical Center, we have a dedicated palliative care team, including physicians from multiple specialties, as well as nurses, dietitians, clergy, social work, and others that assist the primary medical or surgical team and the ICU team. We are available 7 days a week to provide consultations and support to the critically ill patient and their families. We provide same-day consultations to the critically ill patient and their families with daily follow-ups. Additionally, we will have a patient-family meeting within the first couple of days to create an integrative plan with your entire healthcare team to align the treatment plan with your wishes and goals. The intensive care unit is a unique and potentially stressful environment for patients and their families. Important and oftentimes difficult decisions need to be made about your care. Our team will help guide you through those decisions by providing easy-to-understand information about your illness and offering counseling and support throughout to you and your families. Palliative care is not just for the dying. The goal of palliative care is to provide comfort and improve the quality of life when faced with a serious medical illness. Palliative care can be provided for you during your illness. Our intensive care unit and palliative care teams are focused on providing care at any stage of illness. When the illness becomes life-limiting, we will provide care that maximizes comfort while minimizing those therapies that no longer provide any benefit. Our team can help make the transition to hospice, whether at our hospital, an inpatient unit, or at home.
Palliative care is specialized medical care for people with serious chronic or acute life-threatening illnesses. This type of care focuses on the relief of symptoms. This includes pain and the stress of a serious illness, assisting with medical decisions, and establishing goals of care. The goal of palliative care is to improve quality of life for you, your family, and your caregivers. Your other doctors focus on your general health or treating your disease or condition. Palliative doctors concentrate on preventing and alleviating suffering and improving your quality of life, and helping you and your loved ones cope with the stress and burden of your illness. There are many symptoms that people have during the course of a serious illness which may indicate a need for palliative care. These include pain, shortness of breath, diarrhea or constipation, nausea, loss of appetite, depression or anxiety, fatigue, or difficulty sleeping.
The chaplain's a member of the interdisciplinary palliative care team, including nursing, medicine, and social work. I'm a trained listener and bridge between patients and the clinical team. I help the two sides understand and hear each other. Through close listening and spiritual assessment, chaplains help patients define their goals, hopes, and dreams. When listened to, patients come to process the impact of illness and changes that it brings. Defining what is important helps patients and families decide which treatments are wanted based on their own values. At best, I help patients find themselves through their own story, and I help the interdisciplinary team understand the patient and family in personal, emotional, and spiritual terms. I work inside and with the healthcare team, and also alongside community clergy in a complementary role to support the needs of patients and their families. My goal is for spiritual care to be fully integrated into palliative care. We will treat the entire human being in all of his or her complexity with respect to culture and personal history, based on an understanding that all people deserve to be treated as reflections of the divine. Spiritual care will play an important role in helping patients and their families cope with pain and end-of-life issues. All members of the palliative care team will deliver care informed by empathy and an embrace of our shared humanity. In terms of seeing a chaplain, the choice is entirely up to the patient. In fact, the patient is not only a member of the care team, but the most important member. Ideally, the patient will guide the treatment if they're not already too sick to do so. The chaplain's not trying to convince or proselytize, but to meet the patient where he or she is, to listen very carefully to the patient's needs, fears, and hopes. Each encounter is based on the desires and needs of the patient and family. As chaplains, we endeavor to help connect people with their resources, their spiritual strengths, to help them to ask for help of friends and family when appropriate, and to reconnect with their whole self, the totality of who they are now. Yes, affected by illness, often severely, but not reduced to being that illness. This happens through a person telling his or her story, finding the I of personhood, not just the it of disease. The details differ entirely from person to person, but the act of telling and of being listened to with care, at its best, creates a reintegration of the whole self in light of an entire life of lived experiences, now coping with illness, but not defined solely by illness and loss.
As a palliative care nurse, much of my time is spent at the bedside, assessing and caring for the patient's symptoms while providing ongoing support and education for both the patient and the family. As a palliative care RN, I act as a liaison between physicians and patients and spend much time communicating with the patient and family to determine their goals of care. The patient's wishes are always our number one priority. It is my role to assure those wishes are heard and communicated to all team members. There is certification for nurses in palliative care, which is offered by the National Board of Certification of Hospice and Palliative Nurses. A nurse becomes certified after completing clinical hours, studying, and passing an extensive examination. Certification is maintained through ongoing continuing education courses and needs to be renewed every 4 years. Patients and their families feel comfort in knowing that the certified palliative nurse has greater knowledge and is highly skilled to care for patients with serious illness. Here at Englewood Hospital and Medical Center, many of our nurses, like myself, have had specialized education in palliative care and have become certified to better care for our patients and their families.
Hospice is for patients who have a life-limiting illness who do not wish to pursue aggressive treatment or do not have a treatment option available to them. Hospice is not for patients who are actively dying. We provide care to those individuals who want a better quality of life in whatever setting that may be, whether it is within their home or a healthcare facility. We want patients to live and enjoy life with whatever time they have left and fulfill any wishes they may desire. It is our job to make that happen. Hospice involves a team approach. The patient and family are assigned a nurse case manager, social worker, home health aide, pastoral care, volunteer, and music therapist. A patient and family can decline those options, but a registered nurse is required. We send any necessary equipment and medications related to the terminal diagnosis to keep the patient comfortable at home. Hospice's bereavement team will follow up with the family for up to 13 months after someone passes away. Hospice care is available at the patient's home, which is something we like to encourage. This way, the patient remains in the comfort of their own environment with familiar surroundings. As an alternative, hospice services are also available within a rehabilitation facility or a true inpatient hospice facility. When I entered nursing, I began with oncology at a large medical center where I had many learning opportunities. I worked inpatient and outpatient areas and spent my last 2 years working clinical trials where some of the drugs we were researching had never been tested on human beings. I saw patients coming in daily for experimental treatments, blood transfusions, or IV fluids, and I could see that some of them just wanted to be home and comfortable. But the doctors had a hard time letting them go or think that they were giving up. A personal experience of mine also led to me to this career. I unfortunately lost my brother and father 5 years apart in tragic accidents. I never had the opportunity to say goodbye to them. No preparation from a team of individuals who specialize in death and dying. Had I been given the chance to say goodbye or help them live out their final wishes, I would have felt differently about their passing away. I have a huge sense of accomplishment and purpose knowing that I can give other families who choose hospice this satisfaction. I have worked with other hospices in the past, and I can honestly say that the goals and philosophies of hospice are the same, ensuring patients are comfortable both physically and emotionally. The VNA of Englewood is a member of the VNA Health Group, the largest nonprofit community healthcare provider in New Jersey. We service more than 100,000 people annually, keeping the patient's best interest in mind. We continually seek meaningful opportunities to add comfort to the lives of our patients and families in their home to allow for a peaceful, comforting hospice experience.
Nurse practitioners have been in the forefront of efforts to improve quality of life for patients and their families throughout the experience of illness. As nurse practitioners, we utilize advanced knowledge to treat physical, emotional, social, and spiritual needs of our very seriously ill patients. Through our outpatient program, we meet our patients at the time of diagnosis and remain partners with them and their families, providing compassionate and humanistic care. We utilize advanced knowledge, clinical judgment to prescribe, coordinate, implement, and evaluate a comprehensive plan of care. The essence of palliative care is embodied in what I do every day: pain and symptom management, patient advocacy, and education for patients and families. I develop a therapeutic relationship and partner with my patients. I take into account their wishes and beliefs. I help them to plan their care and to improve their symptoms and overall quality of life. Integrative medicine views health from a whole person perspective and strives to address each person's physical, psychological, and spiritual health. Integrative medicine at Englewood Hospital and Medical Center is patient-centered and combines the best conventional medicine together with integrative therapies such as therapeutic massage, acupuncture, yoga, Reiki, aromatherapy, holistic nutrition, and mind-body therapies such as guided imagery. What makes us unique is that we've truly embraced the integrative model. Not only can patients and families receive services in our outpatient center for integrative medicine, additionally, these modalities are provided in the hospital, at the bedside, and in our outpatient areas. For example, in our infusion center, patients receive a Reiki session along with their chemotherapy. Patients going for surgery, tests, or procedures can have a guided imagery session to reduce their stress and restore a feeling of well-being. Integrative services are also provided at the bedside by our expert certified therapists. By incorporating integrative medicine into pain and palliative care, we offer additional ways to merge symptom control of pain, alleviate anxiety, and enhance our patients' overall quality of life. Not only are these services provided for patients, but they are also for our families and caregivers. At Englewood Hospital and Medical Center, we are leaders in the community for palliative care. Our strong commitment to our community is evident as we currently are building our future and expanding our palliative care program. Construction is almost complete on this visionary outpatient facility. The new facility will also be home to our Center for Integrative Medicine. Englewood Hospital and Medical Center will transform the future of healthcare and the way palliative care is delivered in the metropolitan area. At Englewood Hospital and Medical Center, our team works together for our patients and their families by combining innovative technology with humanistic and compassionate care. Not only do we enhance our patients' lives and the lives of those who love them, but the work that we do has an amazing way of enhancing our own lives. Here at Englewood Hospital and Medical Center, we will continue our commitment to you to be a regional leader in providing state-of-the-art compassionate care in a humanistic environment. If you or your loved one is interested to learn more about our palliative care program, speak with your primary care provider and call one of our nurse practitioners who will partner with you and your family in a compassionate and therapeutic relationship that will enhance your quality of life and ours.